Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started. I'm so happy to have Emily Jacobs on the Arthritis Life podcast today. Welcome.
Thank you. I'm so happy to be here.
Yay. Can you give everyone just a quick intro to you, like where you live and what is your relationship to arthritis?
Sure. So Emily Jacobs, I live in Maryland, in Southern Maryland, which is an important distinction because we're south of where most people think we are. Maryland has this weird peninsula that comes down.
Oh, okay.
Yeah. So like I tell people, I used to live in Northern Virginia and then I moved south to Maryland, which is like,
oh, that is
people are like,
confusing. Yeah.
"What?" Yeah, but I did. So yeah, but about 30 miles outside of DC. So that's the nice part. I have access to a lot of resources here. A little bit about me is I've been an ER nurse for about 12 years, mostly working, well, only really working night shift. I have 3 kids. Their ages 10, 8, and 4, 3 girls. I'm married, and I've been dealing with rheumatoid arthritis since I was trying to look back at this. I was formally diagnosed when I was around 22, 23. So I think we say 2005 just to keep it easy. And I think like with a lot of people, it took me a little while to really accept that diagnosis. And well, it took me a really long time to accept it, but to even just believe that that's what it was. I saw a lot of different rheumatologists in the first year or two. Just trying to get additional opinions, and they all drilled it in that they all thought it was the same thing. So that was on one hand nice, but yeah. So I've been dealing with rheumatoid arthritis for almost 20 years, not quite, and it's been up and down, to say the least.
Had you already gotten your nursing degree at that time?
No.
Okay.
I was fresh out of college, actually.
Okay.
So
okay. We were really similar.
We're really similar. Yeah.
Just like a year behind you chronologically, but yeah.
Yeah. Like that. I think that was one of the things that drew me to your podcast. And like, once I started hearing your story, because it was like, oh, this is nice. Someone who's around my age talking about RA. That's exciting. And then it was, oh, wait, we have very similar kind of landmarks in our story. Yeah. So I had just graduated from college. I had moved to DC. I was like living, the single young lady life with my girlfriends, roommates. Everything was great. I had played Division I water polo in college, and so I had been I've been an athlete my whole life. I was really strong. I was, fit, sort of, but I'd always been an athlete.
Water polo is not a sport you can skate by on without being fit.
Yeah, right. Like I weightlifted, I did all that stuff, and I actually was still playing water polo when I moved to DC. There were some adult teams, like masters teams down here, I was playing on two different teams. And that's where I started having real symptoms that I was like, what's going
Oh.
on? I can't, that's a weird pain. Like, and I had plenty
Mm.
of shoulder issues in my years of sports and stuff like that. So I knew a little bit. But this was a different pain and
Hmm.
also just like a different functionality. Like the stiffness was there. And I was like, what's
Right.
happening?
Yeah, it does
So
feel quite different than like a muscle soreness that you get
yeah,
from overexertion and stuff like that.
totally. Yeah, exactly. And
Mm.
I couldn't identify, like, it was weird because I was like, I know my body, like, I know these kinds of things. And
Mhm.
not being a medical person, just being someone who had gotten enough injuries and stuff like that. And
Mhm.
so that was what made me, it was that. And I had swelling in my knees bilaterally.
Oh, okay.
So when I went into my first rheumatology appointment, well, actually, I did have one doctor tell me that she didn't think it was anything. But when I went
Mm.
in to a rheumatologist, everyone was like, "This is textbook RA." Like
Mm.
you're the spitting image of the textbook of the descriptions and all of that. So I've never had positive blood work.
Oh,
It's
okay.
I've always been. I mean, I've had elevated numbers with things like CRP, of course, and
Mhm.
like
Mhm.
I've had some elevated things, but I've never had a positive RH factor or
Oh,
that kind
wow.
of stuff. But I've just been such textbook symptoms that every doctor who's
Yeah.
ever looked at me been like, "This is RA."
So,
Okay.
okay, so after you got all those second opinions, like
Mhm.
when did it sink in and what did that feel like when when you kind of had to accept that you really have it?
Okay, so in hindsight, I feel like this sounds a little bit crazy, but this is the honest truth. Okay,
No, this is
so
what we're here for. Honest arthritis
right,
truth. Arthritis life
yeah.
truth.
Well, sometimes I'm like, what was I? What? Well, so okay,
Know
so
better, do better. Yeah.
right, yes,
Hindsight's always
exactly,
2020.
right, yeah. So my symptoms would appear for the first several years only in the summer. I don't know if that has to do with humidity and barometric pressure in DC. I've had some people say that to me. I don't know, who's ever going to know, but I would only have symptoms for like late May until August timeframe, and I for a while could manage those with Advil, Tylenol, Aleve, just alternating so that I didn't get too toxic. But I would take those things. And particularly because none of the rheumatologists wanted to put me on any hardcore medicines because I was so young. So they were kind of like, well, if you can just deal with it, just deal with it. And of course, I
Mm.
was an athlete. You're
So
talking
you're
to
like,
an
yeah,
athlete. I can deal
but
with it. I can deal with anything. Right.
just so people know that who are listening now in 2022, the current recommendation is 100%. The current recommendation is opposite of that, is early aggressive treatment. But so it's changed a lot in even just 20 years. But for
Yeah.
some weird reason, my rheumatologist she was following the recommendation that they're doing now back then. I think it
Oh,
was maybe
really?
just luck of the draw. And that's what can drive people nuts, is that there's a lot of
Mhm.
variability between professionals. And that's just the nature of healthcare, right? Like,
It
as an ER
is.
nurse, probably
Yeah.
way more than I do. But the point is
Hmm.
that she put me on methotrexate and Enbrel right away. And I know,
Wow.
and that doesn't even, it's unheard of now to even get approved for a biologic that quickly
I
because,
was just going to
or
say,
sorry,
you got a biologic
I think I did
that
do,
early.
I always say right away, I think I was on methotrexate by itself and prednisone for like 3 months. And then when it was still like,
Okay.
I guess all my markers were just so
I was
awful.
going to say,
And like,
it must have been really severe
well,
too.
and I
Yeah.
had
Or,
rheumatoid cachexia, like, which is like severe muscle wasting. Like I had gone from
yeah.
130 pounds to 105. Like, and
Oh
I
my
had, of
gosh,
course, been
Cheryl.
accused
Wow.
of having an eating disorder and all this stuff
Mm,
before. And I'm saying accused because I didn't. I wanted
hmm.
to eat. I wanted to look, I wanted to, be strong and bigger like I was before.
Hmm.
But
Hmm.
no one had, I mean, who in the world would think I have one sprained finger, quote unquote, sprained finger? I only had one joint that hurt. Now that is weird, but,
It is.
but
Yeah.
then that was for a couple of years before diagnosis. Then when I got my diagnosis, or the reason I got my diagnosis is that I then, after I lost these 25 pounds, 25 pounds, I can't even explain how I thought I was just dying. But if you think you're dying, and then everyone's like, but you're just anxious. I'm like, ugh, like I can't win because I am anxious because I feel like I'm
Right.
dying. Like,
Yeah.
but if I
Understandably.
tell you
And you
that,
were
then you're
early
like, yeah,
20s.
you're dying because you feel that way because you're just anxious. I'm like, no, I'm anxious because something's happening in my body. I know something
Mhm.
wrong is happening in my body, but every time I say that, I sound more crazy. It's kind of like Taylor
Mhm.
Swift's, like, every time you say I sound crazy, I get more crazy. Anyway, but then I woke up one morning and lucky for me, all of my fingers, toes, every single joint,
Mm.
knees, elbows, suddenly it wasn't just one sprained finger, it was everything. And
Oh,
that's when I got my diagnosis. And they're like,
wow.
okay, yeah, you were not lying about not having
This
an eating
is
disorder.
it.
You actually
Yeah.
have rheumatoid arthritis. Anyway, but point being, sorry, but that even back then, there was a lot of variability. And I do know that a lot of people did say they're worried because at that point, the biologics were so new that they didn't know the long-term side effects. And they didn't know if
Hmm.
they were going to be causing cancer and stuff like that. So anyway, sorry, I
Hmm.
just want to make sure people who are listening now know that a lot of people do want to be conservative at first, but the best
Hmm.
practice is to be more aggressive
Hmm.
with medication at first and then taper it down
Hmm.
later.
Yeah.
Yes.
Well, and I do, to give credit to the medical professionals that I did see. I mean, they, my blood work was negative, so I think they were
That's
like,
true. Yeah. Yeah.
you're a 23-year-old who's been an athlete, like, not, but like I was strong, you know what I mean? Like I,
Yeah.
I
It
wasn't
wasn't like
losing
my case. Yeah.
weight. I wasn't, yeah, like
That's
we
true.
presented very differently
Mm-hmm,
at the
mm-hmm.
time. And I would go in and sort of, and I would have all these sort of, like, I was questioning things. I was not a nurse, as we said, like I was not a medical
Mm-hmm.
professional, but I was like, I just get this weird swelling and stiffness and pain for like 3 months. But if I get moving around, I feel better. And so it's
Mm.
fine. You know what I mean? And they were like, yeah, that sounds, and I was like, but what? The thing for me, and this is such like a personal little side thing, but I remember, and I don't remember when this was, but it was after I had at least seen one of these rheumatologists who said, yes, I think it's RA, blah, blah, blah. In the beginning, I didn't know what that meant. To me, it was like, oh, a special kind of arthritis, but like, okay, it's
Mm-hmm,
arthritis. It was that
mm-hmm.
I totally fell into that misnomer of like, hey, it's just this. And I
Yeah.
remember calling my mom, my mom is a nurse. And I remember, and she
Oh,
was there's the whole joke of like, you're raised by a nurse, which means like, there's never anything wrong with you. Like, everything
yeah.
is like, you're fine, just rub it, you're fine, which was totally like, that's a joke in our family.
No,
But
yeah.
when I called my mom and told her that I had she immediately went, no, like yelled into the phone, no,
Mm.
because she knew what that meant. And I just remember being like, this is my mom who says everything is fine. It's no big
Yeah.
deal. Just deal with it. And she's not harsh. Don't get me wrong. Like, but
No, it's,
it,
yeah,
things are, because she also has enough sense to know if it's really a serious emergency or not, right? And
exactly.
as an ER nurse with my kids, I get it.
Yeah, yeah,
But
yeah,
she was like, immediately was like, no, that's a terrible diagnosis. And
yeah,
that's what actually kind of scared me in the beginning. And then I started doing some research and I was like, oh, this is not a good thing to have. Like, this
yeah,
stinks. And I remember trying to find books on it. And a lot of the stuff I read was all about people who were older. I mean, it was
yeah,
truly like, at that point, it was like everybody's in their, 60s or 80s when they get RA. It's
yeah,
like,
yeah.
what? Like, how am I?
It's,
So, yeah, but that kind of, I was saying, like, I saw a bunch of different doctors. Like, I saw them over the first few years,
mm-hmm,
and then, but it would also be like I would just see them when I would have the symptoms flare up, and they'd flare up in the summer. But then I'd go for
mm-hmm,
like 9 months, totally fine, going to the gym, working out,
mm.
doing all this other stuff. And to that point, my husband, so he's my husband now. We've been married for a while. At the time, he was my boyfriend. He ended up having a huge medical situation,
Oh
which is
no.
what led me to become a nurse. So it was like he had this
Oh,
huge thing that it's a long story, but basically he was in the ICU, he was in the hospital in and out for several like
oh
weeks
my
out of a couple
gosh.
different months. He was out of work for 6 months. Like, it was a big thing when we were in our mid 20s to go
Mm-hmm.
through. And
Wow.
I was like, this is fascinating. I think I want to be a nurse now.
Mm-hmm,
um,
mm-hmm,
and so I became a nurse, which was great. And so all of my symptoms, even when I was flaring, they were still manageable. They were still pretty mild.
mm-hmm, mm-hmm.
And then I was looking at this before because I did try. At some point, they did get a little worse, and I tried like some of the other first ones, like diclofenac or like
Mm-hmm.
Voltaren was one I tried in the beginning.
Mm-hmm.
Plaquenil was one I tried for a little bit, but I have issues with my eyes, and because of that. They wouldn't let me take Plaquenil for more than a very short time. And I did go on methotrexate for a little while, but that it didn't work really at all for me. And I'm trying to remember when I went on it. I went on it for a period just to try. I think I went on methotrexate after my first daughter was born because I didn't want to go on it before having kids because I was nervous about that. But I had my first, and then I had really bad flare-ups after each child was born. And it also seemed to just take me up a notch in my disease progression. So after each kid was born, I ended up on a higher, a more serious drug. And my symptoms were worse and had to manage it. So like I was on methotrexate for a little bit and then it didn't work, went off of that. I think steroids were always the thing that saved me out of those bad flare-ups, which, I'm sure prednisone is like, I love it and I hate it. I love it for 3 weeks and then I'm like, get it away from me.
They call them the devil's Tic Tacs.
Exactly. And I tell people that all the time. I think you're the one I heard say that. And I'm like, it is the devil's Tic Tac because it's just so, it's so double-edged. It's like you get that
true
relief.
Definition.
But then it's not worth it. So, and I did do like acupuncture and stuff in there. And I was on like a bunch of herbal things and I had different experiences with that. I had like on one acupuncturist was excellent. I tried another one when we moved to Maryland because we used to live in Virginia and it was not that, so that's another, it's being a clinician, I get it, people have different strengths. And so you have to figure out what's going to work for you. But so I tried different things. I don't even remember what the question was.
No, actually it's perfect because the initial diagnosis, I think there's initial diagnosis journey and then there's the treatments. I put this in my notes. I have treatment story / saga because sometimes the treatments it's,
That's exactly it.
Yeah.
That's
and
exactly what it is.
Again, I think for me, I had this weird, I had this honeymoon period with rheumatoid arthritis. When I had the textbook positive story of I didn't have any of the classical markers until I did. And then at the point when all my joints started hurting, I had every possible, everything was positive. Everything was off the charts. So, and then I went from that to everything, blood work looking good, no inflammation, no subjective symptoms. And they told me, this is what we hope. This is what we hope happens. You go on the medicine, it puts you in remission. You just take the medicine. And yes, it may have some side effects, but we're going to be optimistic here. And so I was like, check. I figured this out, like X this off of my life to-do list, just take this medicine the rest of my life. Like go to the doctor every 3 months, get my liver checked because I'm on methotrexate, go off methotrexate when I have a baby. Like I had my whole life planned out, and I was like, okay, like after the initial shock, sorry, I'm talking about my story now. So let's talk about your story. But point being for me, it was like, okay, we figured it out. And then, when the treatment became a saga was when my body created antibodies to Enbrel. And it was like that insert like cartoon, like screeching halts, like what? Like it was like a Wile E. Coyote, like falling off the cliff. Like, but wait, like they always say like insanity is doing the same thing and expecting a different response. Like it can make you feel insane when you do the same thing and you get a different response. You're like, but I took Enbrel. Like Enbrel's the solution. I just took it. Like, was there something wrong with it? Like, did I not refrigerate it correctly? And they're like, no. Like your immune system is like kind of dumb and really smart at the same time because it like made antibodies to the medicine. It's like, I hate it. And so anyway, so then it became more of a saga, but back to you. But so you've tried a lot of different things. I know that cannabis is something that you've tried as well. I would love to hear more about that because that's definitely a hot topic.
Yeah. Oh, I know it is. So I I had tried cannabis as a kid, right? And then
kid or like teen. Okay, sorry. I was like, wait, that's not normal.
Late teen. Okay. Oh yeah, sorry. Late teenager is when I played around with it a little bit in college. Like
got it. Yeah.
Not a kid, sorry. And then I'm trying to think. It was actually I'm trying to think when that was. It must have been 2018. Because it definitely was 2018. My third daughter was born December of 2017.
Okay.
And I know with her, I was on Enbrel, and I remember, because I remember getting in touch with the doctor, like, could I breastfeed with Enbrel? Is this going to be safe? Like, she was a preemie baby and there had been a lot of
Mm.
complications. So I was like, I really want to breastfeed her. This is really important to me, but also I cannot function.
Mhm.
So can I use this Enbrel? And I was trying to remember when if this was when I started it. I think this is so I started taking Enbrel and so I had some relief, but I also, Maryland is a medical, well, I don't say marijuana because it is a lot of people consider it a pejorative term. So I do always say
Mhm.
cannabis, but they
Okay,
call it
okay.
a medical marijuana program. So
Mhm,
it's one
mhm.
of those things, but I always
Yeah.
trip over it because I know that it's a word that I don't like to say. So,
Okay.
um,
Yeah.
but so I established myself as a patient and said, I got to try something because I've now got these three kids and I can't keep up. And
Yeah.
at the time, I actually was not working at that time. I
Okay.
had taken a little break because the ER had gotten really hard to keep up with two kids in the ER. And so I wasn't even on a maternity leave at this point. I was just
Mhm.
not working for
Okay.
a period. Um, but so started using cannabis. I will tell you, and this is part of the reason that I'm now getting a master's degree in medicinal cannabis and why I'm happy to talk about it because the pretty much every single state, the way that they've set up the medical programs, and I'm talking about specifically medical programs, is there's a lot missing for patients.
Mm.
And it's really frustrating as both a patient and a medical professional that we're toting this as medicine and we're pretending like it's medicine only because it's a workaround for people to get access to it. But the
Mhm.
fact is, it truly is a medicine and it was used as a medicine for tens of thousands of years, way before we ever turned it into the gateway drug. It was a
Mhm.
medicine way before that. So
Okay, yeah.
historically, internationally, all across the world, particularly in Asia, but all across the world, it was used medicinally. It used to be in
Right.
the US pharmacopoeia. Like it was listed as a medication.
Oh
Yes.
my gosh.
Yeah. Like it was all there.
I
So
didn't
that's
know
what kills
that.
me. Yeah. Most people don't because, especially those of us who grew up in the 80s,
Yeah.
it was like the number one bad drug that's going to ruin your life and set you on a path to all these other drugs.
Mhm.
Well, it wasn't that. And there's a whole lot of reasons. Most of them are politically and racially charged. I'll just say that.
Mhm.
Anyway,
Mhm.
that's another soapbox I could get on. But so what's hard about cannabis is it definitely can help with a lot of things that I experience with RA. And I think a lot of people like it can help with the physical pain. It can also help with the anxiety and depression
Yeah.
that I certainly experience, and I'm sure a lot of people do. Um, you can also use parts of it that do not impair you, so that you don't get the high feeling. You just get physical relief or
Right.
spiritual relief. And I've been using it regularly now for years, and I can tell. I mean, I've never once gone to work impaired. Obviously, I've never
Mhm.
once
Mhm.
even been worried about it. Like you can manage it that way, and it's helped me so much with RA because partly because I've been willing to experiment. Now I don't necessarily think that's the case for everyone, but
Mhm.
unfortunately
Mhm.
that's what we've set up for people. We have people like I go to the doctors can write certifications, which means you get to have access, but they do not write a prescription. There's no
I
prescriptions
know, it's
anywhere.
so confusing. How are you supposed to be able to get it? How do you
You
get it
walk
from
into this is the problem. You walk into a dispensary and you talk to somebody who's got a high school diploma and no medical training, and they go, "Well, this
Yeah.
one smells really good, so get that one." And it's
That's
terrible.
yeah.
I've
Yeah.
experienced it. Yeah, it's very frustrating. So if people are interested in cannabis, I would say there's cannabis cannabis nurses are a thing.
Okay.
I know a whole bunch. So if someone wants to meet, in person with one or something like that, I mean, I could easily connect people. I don't
Nice.
work as a cannabis nurse right now, for a number of reasons, but I could certainly connect people to one. But I do talk to a lot of them, and I mean, I'm doing a lot of the research in school right now, to figure out what I need. But there's a whole world of science behind this that legal, excuse me, political things get in the way of. And
Yeah.
it's really
Yeah.
unfortunate. But there's also, there's an organization called Americans for Safe Access, or ASA.
Okay.
And they basically are just about patients. They advocate for patients. So they are advocating for patients to have access to cannabis. And that doesn't just mean a state that makes it legal. It means having it written into the law, things like, okay, can the cannabis be delivered if someone is homebound and they can't get to the dispensary? It means actually rescheduling cannabis out of a Schedule 1, which is what it is now because of the CSA, which was passed in the 70s. They made cannabis it's a Schedule 1 along with heroin and LSD and other things, which means very specific things. It means these three things. It means, one, it has no medicinal value. It means it means that it has a high danger of abuse. And what's the third one? Now I'm blanking on it because I'm trying to think of it right now. There's a third point that is, what is it? I'm sorry that I can't remember right now. But basically, the point is, it makes it so that we can't research it.
Right.
You can't. So in this country, no research can be done on Schedule 1 drugs. And so the problem, and when I say drugs, I also mean medicine. I'm a nurse, so to me, drugs are
it's true.
Medicine.
Yeah.
I'm not talking about street drugs.
Right.
But so that's what's so frustrating, is that we are missing out on all this research that we could be doing. And sure, there's people like me. There's also kids who have disorders like Lennox-Gastaut syndrome, which is when they have hundreds of seizures a day and they have no functionality, no quality of life. Those kids take really high doses of CBD. And there is a drug that is approved by the FDA called Epidiolex, or Epidiolex. It depends on how, there's people say it different way, but it's CBD. And kids take it, these kids can take it, and their seizures, they don't go away completely, but they can function. And I've seen the kids speak. Like, I've seen them present at conferences. These are kids who would have died, and they're alive and they're functioning now. And they're not like 100%. But anyway, the point is, what's frustrating is we do have FDA approved drugs. We also have, there's 7 or 8 patients. I think there's only one left, but from the 70s, the government, the federal government, was sending patients cannabis, literally rolled joints. They would get 10 joints a day. They've been doing that since the 70s. They still are. Just those patients, though, because they got in before
the seizure. Yeah.
Okay. Not even seizure. Like, these are like people who, so there was this guy in the 70s who basically, he took it to the Supreme Court and said, I'm using cannabis to treat glaucoma, and it's helping me, and I need to be able to use it. And he won. And so the government, so like, this is what's mind-boggling about all of this. So there's FDA approved Epidiolex, there's FDA approved Marinol, which is another cannabis drug, which is THC, which is the impairing component of the cannabis plant.
Right.
So we have that too. Okay. So the government, it's not about what's in the plant. That's the thing. Because we have all these FDA approved things, and the government does send certain people things. It's just, they don't, I think there's a lot of theories as to why, but the point is, cannabis can be really helpful. You just have to find the right people who know about it, because of what has happened in this country with outlawing it. It's made everything confusing and wacky. And so if you're someone who doesn't know a lot about it, and you get a card, you're basically left on your own.
Yeah, and that
to
feels
treat your
really
symptoms,
scary.
which is hugely problematic. Because the other thing is, a lot of the dispensaries, whether they're medical or not, no matter where they are, they're going for high THC content, because that's the attractive thing. People just want to get high. Right, exactly. And I'm not going to demonize that. That's its own thing. But for people like me, like, I do want some THC, but I don't want crazy amounts of THC. You know, there's a time and a place in it. If it's dosed correctly, it's a therapeutic medication.
And I was going to also mention that I did do an episode with Christina Montoya, who's a registered dietitian, who's also studied cannabis. And she kind of gave like a cannabis for pain and inflammation 101. So I'll link to that episode in the show notes for people who want to learn more. But yeah, I appreciate you sharing that, because it helps reduce the stigma, especially I think when, licensed health providers kind of speak to it.
Mm-hmm.
It helps people realize, oh yeah, this is, especially with someone's living in pain, why would you want to deny them something that could help? But I know that there's going to be some people listening. One of the questions I get a lot is, about pregnancy and having small kids with arthritis. So that wasn't even going to be the focus of our episode, but I am curious. First of all, like, did you have fears, like with even just your first pregnancy, of how the rheumatoid arthritis was going to go? Do you know what I mean? I mean, I'm sure again, that could be a whole story on its own.
Yes. And I remember I was like, so with my first pregnancy, I was a little bit concerned because it was like, oh, I have this condition. I have this thing now. But back then, I mean, I knew what it was, but it was still kind of dormant. Like I would have these dormant periods. And so, and my first pregnancy, I was one of those people actually with each of my pregnancies where I had no symptoms during pregnancy.
Me neither.
At all.
Yeah. I only had one pregnancy, but yeah.
Yeah. So part of it was, I mean, by the time I got to the third one, I was like, I should stay pregnant all the time because this is when I feel the best in terms of RA. I didn't really work. My first and second pregnancies, I was really lucky. I had relatively easy. I mean, I had some things, but like sciatica pain, not, nothing. I was working through both of those. I worked 12-hour overnight shifts in the ER through both of them. I worked up until the day I delivered.
Wow.
Like, I was really...
Nurses are a different like level. Like I'm sorry, but just like you're a badass.
Well, thank you. But I also felt great.
I love you even if you're not
hard to do that.
Yeah.
Right?
Yeah.
Exactly. I'm like, that's the thing. I'm like, now I'll tell you, like, my last night shift in the ER was in September because I'm not doing that anymore because I can't for various reasons. But so thank you for that's been, then. But I did with my third kid, there were some complications, and I do in my head kind of associate them with RA. Like my body was like, we're doing this again? We're like, really? You're gonna make me do this again?
Yeah.
And she's fine, but she's had some health issues. Like, I mean, her umbilical cord it only had 2 vessels instead of 3. Which that doesn't necessarily connect to RA, but in my head, it's like, well, your body's imperfect and it attacks itself. So,
I thought of that when I was pregnant.
You know what
everything. Yeah, I had a textbook pregnancy except for gestational diabetes, which was like super mild and well controlled. But
I had that with my third one too.
Yeah, I was like, really? And what was hilarious is that I was going to this certified nurse midwives at the hospital because I felt like, oh, I can have this, like, because it's your pregnancy, depending on go to your doctor and see. But my doctor said, in my current disease state at the time, I was not considered high risk just because of rheumatoid arthritis, because it was well controlled and I could continue taking my meds during pregnancy, except for obviously getting off methotrexate before getting pregnant.
Yeah.
But so it's not inherently high risk. But I remember I had asked so gestational diabetes is more like type 1 than type 2. It's not caused by like what you eat, but it's at least that's what they explained to me. Tell me if I'm wrong. As a nurse.
No, that's right.
But I thought it was my fault. But I had just the funny thing was I had just asked the nurse midwife the week before. I said, I feel like I'm like really craving sugar. And I was like, she's like, oh, you're fine. Like, as long, and like, she said something like, just as long as you just like limit your sweets to like once a week or something. I was like, once a week, once a day would be limiting it. And then of course, like a week later, it gets diagnosed with gestational diabetes, even though I know it's not. Actually, at that time I didn't know it wasn't caused by me. I thought it was my fault, and I was like, curse you. I should have listened to you.
Right.
And only had one dessert a week. I was like, how do people live like this? Anyway, but back to your story. Sorry. But so you had more complications your third pregnancy.
Yeah. And it's funny you said that because I crave sweets with each of my pregnancies. So like sweets with all of them. And my first year I was fine, but that third one. And I was like borderline. I remember I had to do the 1-hour glucose test 2 times. And then I had to do the 3-hour glucose test 2 times because they were both like, it just kept being borderline. And I was like, okay,
you're a nurse. Can they just let you monitor your glucose on your own?
It was like, oh my God. And by the time I got diagnosed, it was funny because I finally get diagnosed. So now I'm having to like manage it. Okay, fine. Well, and then she was born early. So I only had, that's what I mean. Like I lucked out with a lot of it in that I only had to deal with it for a few weeks and it was okay.
Yeah.
But
Well,
yeah, so
I know a lot of people worry about like, am I going to be able to cope with pregnancy with my condition or cope with parenting? And I think what's hard is that there's an uncertainty to it, right? Like 70% of people
yeah,
roughly go into remission during pregnancy, that you could be in the 30%, right? Or the 70%.
yeah,
But I
yeah.
was similar to you in that I was like a bit, because I've only had one pregnancy, but optimistic and like, okay, I can handle this. And then I had some other health issues, which made it so that we decided not to have, try to have another child. But it
Gotcha.
wasn't the RA alone. It was the other stuff kind of all piled on top of each
Hmm.
other. But
Hmm.
so I forget where I was going with that.
Well,
we're
I was going to
similar.
say
We're like,
we are, yeah, we are. And I do think it's interesting because, like I said, like I felt better in pregnancy.
yeah.
So I was like eager to get pregnant again. Like
Yeah.
it always felt like this is a relief for me. But after each
Okay. Well,
pregnancy, and
that's what I
that's,
was going to
like,
ask. Yeah. The
yeah. So I was
post.
going to say after each pregnancy, that, and I mean, part of me doesn't want to like scare people.
No,
It
it's
wasn't,
your
it
story. Yeah.
wasn't terrible, but I mean, I distinctly, so with my first kid, I did have a bigger flare, but like I honestly don't even fully remember a whole lot of it. Like
It's a
it was
blur. Yeah.
okay. It was, yeah, exactly.
Mhm.
But I remember with my second daughter, um, wanting to breastfeed her like in the middle of the night, and I couldn't pick her up. Like I couldn't, I couldn't. I just remember
Yeah.
trying to like scoop her with my forearms because my hand, I couldn't,
Same
like
thing.
this motion, and it like that comes right back to me where that felt, I mean, of course it's physically painful. You're trying to feed this crying baby in the middle of the night. The feeling of failure of like, I'm not physically able to do it. How is that possible? Like, and to your
Mhm.
point, I'm a night shift ER nurse. Like I was a Division I athlete.
Yeah.
I'm a badass. Am I? Because I
Mhm.
can't even pick up my newborn.
But the thing
So
is
that
that,
doesn't
yeah,
feel good. But
no,
that, like it's,
I
yeah.
think,
So
I,
it's
th-
a lot.
oh no, it's super emotional, especially if you're a first time mom. Like I remember being like, do
Yeah.
I have postpartum depression or not? Because they're like, are
Yeah,
you,
plus all the hormones that are
and I'm like, well, they're
raging.
like, the question they asked is like, are you having trouble like finding pleasure in formally pleasurable things? I'd be like, my life now looks nothing like it looked
Nothing.
before. Like nothing I'm
Yep.
doing, I can compare it to a previous activity. Like I didn't have a
Hmm.
baby before, so I don't know whether to compare.
Hmm.
I've relatively lost pleasure. Like, did I find pleasure in changing a diaper and waking up in the middle
That's
of the night?
motherhood.
Like,
Right.
I don't know.
Motherhood is right. Exactly.
Oh
Yeah. Well,
man.
that was where it was hard knowing what was okay, is this RA? Is this, is it postpartum? Like, and
Yeah.
I even with after my third one was born, where like I said, like I had a really bad flare. It was a worsened flare up after her. I remember actually calling my doctor's office, my OB, and saying, um, I asked for some mental health resources because I was like,
Mhm.
I'm not doing great, and their response, and I get this because again, being a nurse, I get it, but they basically were like, are you currently suicidal, or are you planning on, are you going to hurt your children? Are you worried about hurting any
Oh.
of the kids? Like, are you going to
Mhm.
hurt yourself or your kids, basically? And I was like, no, I'm
Mm.
not at that point. I'm just like, I need some help. And they
Yeah.
were like, here's a list of resources. Like, and I remember I called a couple places, and like two of them didn't take my insurance. One of them was full and didn't have it. Like, it was just like, and none of them could help me. And it was
Oh
like,
no.
yeah, it was really a negative experience. And
I'm so
I just
sorry.
remember being like, well, I mean, but I also kind of stopped there and didn't pursue it any further because I was discouraged. But I also was like, well, I'm not going to go to the ER. I know exactly what they're going to do there. This isn't that
No.
situation.
Yeah.
I just have to like buckle down, like just get through it.
Well, I
Um,
mean, that's what outpatient
but
therapy is supposed to be for, is there's an
right,
intermediary between ER,
right,
like a psychiatric hold, and
right,
grinning
right,
and bearing it on
exactly,
your own.
right, right.
um,
So that
yeah.
was hard, but
Oh,
it's okay.
I got so
I've since
lucky.
gotten therapy, so
Yeah, no, big time on therapy. And one of my friends from swing dancing was pregnant at the same time. She gave birth like 2 weeks after, and she
mm.
had gone to a therapist, and she just recommended her therapist to me. And I was like,
Oh,
good
that's
enough for
awesome.
Rebecca, good enough for me. Like,
Right, right.
okay. I think I called a couple of them, because I knew it's really common. Just if you're looking for therapy for the first time, it's really common to have to like do initial appointments at a couple of them just to kind of see, who vibes well with you. Because it is a relationship, it's a therapeutic relationship with you, between you and the therapist. But yeah, it can be, I just think that family planning decisions are really loaded when you have a chronic illness. Or I know some people listening might've gotten diagnosed postpartum, and then you're like, well, I had this life plan for myself, how I was going to be a parent. Cause at least we knew we had RA before. It's like we could make an informed decision. Right. But other people, I do feel it's like that you feel trapped. You're like, well, wait a minute. Like, I can't deal with this. Like, I can't deal with learning this whole disease for myself and learning how to be a parent. Like, it's huge learning curves all at once. So
and I can't imagine. So yes, we had RA, but I will say this, it felt like a different disease after each kid. Like that felt like a big turning point for me, because it was like, whoa, this is worse than it was before. Like
it's like stage one. It's like they should be stages like there is for cancer, because no, it's true. It's exactly like me. When I was in medicated remission, I was like swing dancing, playing indoor soccer, outdoor soccer. I would actually go play. I would go to work for 8 hours, and then I would play outdoor soccer, and then I would like disgustingly not take a shower. I would go just take my soccer clothes off, change my swing dance clothes, and dance for like 4 hours. Like,
oh my God.
And then I would go to bed. Like that was like my life, and so, even though the diagnosis is the same then and now the disease has progressed, it is a progressive disease. So it changes. So that was actually going to be one of our themes of today's discussion, is like how to cope with the harder seasons of your disease. And what are things looking like for you right now?
So this is actually a good point. So, and I think I told you this on one of our Room to Thrive, like one of the last ones I was on, but so I restarted Enbrel. So I was on Enbrel in like 2018. I don't remember. I was on it for a couple of years, like 3 years, and 2018 was in the mix there. And then I went off of it in the very beginning of the pandemic, because I started to have a flare, which honestly, I think I had COVID in February before we actually knew. Because I tested negative for the flu, but like in hindsight, I'm like, I had respiratory issues. I had like,
and you've been working in the ER
in February. Right. And I'm right. So it was like, and I, I work in Northern Virginia. So we get international, like, we get people from all over the world, because it's local to all over the world. Like people fly into DC for things, right? And so then they end up in our ER. So anyway, so I wait, I just lost my train of thought. Sorry.
Oh, you just restarted Enbrel.
Oh yes. Okay. So I was on Enbrel. It was great. Like you said, I was weightlifting. I had a personal trainer. I felt amazing. And then started to flare, and I kind of thought, oh, this might just be like, whatever, like you make excuses for it. But I mentioned to my rheumatologist, and she was kind of like, well, oh no, you know what? That was when I switched rheumatologist, because so I had gotten really bad shoulder pain in one side. And basically the rheumatologist was like, well, that's not RA. It wouldn't be in one side. You have to go see someone else. And I had been complaining about it for a couple months at this point. And then I switched to a different rheumatologist, which I had been with that one for at least 7 years. So like, I don't want it to seem like I was jumping all over the place. Like I'd been with this one for a while. She'd seen me through all my pregnancies. She had seen me as this progressed and all of this. And it got to a point where I felt like she wasn't quite addressing that need. And anyway, so I did go to a different rheumatologist. That doctor ended up draining my shoulder. I had bursitis, and she drained my shoulder on the spot and gave me a cortisone shot, which to this day, I have never had pain like that again in my shoulder. And that was in 2018 or 2019.
Oh, wow.
2019. So that was really positive, but she took me off the Enbrel. And in hindsight, there's a part of me that wonders if that was the right choice. It doesn't really matter now. But she felt like, well, it's not working. You're flaring. Plus this is an additional thing on top of the inflammation you already have. So she took care of that. We ended up putting me on Rinvoq. I think that's what I went on first. And then
I'm saying as if I know, like So yes, I remember that. No.
Yeah.
Yes.
And Rinvoq, I was excited because it was a pill instead of an injection. And I just
That is
want to say, like,
exciting.
I'm a nurse but nobody likes getting shots. So
No,
I was
no.
really excited to be like, oh, I don't have to do a shot every week like I've been doing for the last few years.
Mm-hmm.
So Rinvoq was exciting, but it didn't, it sort of helped, but it wasn't great. And there were issues like palpitations and things like that just weren't ideal. So then we tried Humira. Humira was not good for my body. I know it's worked
Oh,
for a lot of people.
yeah.
Yeah.
But
And
everyone's
I was
body's
really
different.
hopeful. Exactly.
Yeah.
And this is sort of my plug for like, it is a journey. Like, don't, and you can
Mm-hmm.
have the disease forever and it changes, your body changes. So then the medicines work different. Like it's so hard. It's just such an ongoing thing. But so we tried Humira for a while. That was not good for a lot of reasons. And then, so now I'm back on Enbrel and it does seem, I think it is working. Now I just got my flu shot on October 1st.
Oh, okay.
And I don't know if that's sort of playing into it. It's always a question of like, is this the
Mm-hmm.
thing? I don't know. I get flu shots every year. So,
Right.
I'm not saying it's that, but right now I am having a little bit more disease activity, we'll say, than I have had in the past on Enbrel. So that's where
Mm.
I'm like, oh, I wonder if this is just like, this is where we are now. This is
Yeah.
how Enbrel works. And so, yeah, so it's an ongoing discussion. And I think that's one of the things that I feel like I wish, I mean, I didn't know anybody when I was diagnosed. Like I was just in my own world. But I feel like that's such an important thing for people who are newly diagnosed and for all of us who are still dealing with it, nearly 20 years later, to remember is that it's not just like you were saying, like it's not like, okay, diagnosis, here's the treatment, and now you're good. It's like
Mm-hmm.
it's autoimmune. So as long as you have this body, we're going to be like reevaluating, reassessing, like refiguring out what works and what doesn't, and that kind of thing. So for me, I
Mm-hmm.
think it's really important to have something that's managing or treating the progression of the disease, which is why I still take a biologic. I still want to have those kinds of medicines, hopefully, to be doing their job in my body. But
Right.
that's why I also use the cannabis, because sometimes there's not, the symptom relief that you need from the
Right.
biologics. And so the two need to work together. So for
Yeah.
me, that's what works the best. But sorry, this is the point I was trying to make. But the ER has been my home for the longest time. But now I'm in a phase of life where I'm in grad school. I've got 3 kids who are getting older. And while on one hand, it's like they need less from me, they don't need their diapers changed and that kind of thing, but they're doing sports or they're doing Girl Scouts or
Yeah.
they're
It
doing,
changes.
whatever.
Yeah. Yeah.
So I need to be around for that. And so I'm balancing a couple of different, I call them gigs because that's what they feel like. They're nursing
Yeah.
jobs, but like they're gigs that I kind of fit into my life however I can. And then I've got school and got stuff going on. But so the main thing though that's different is that my daily management of my symptoms
Mm-hmm.
takes a lot more time now. And
Oh.
so working a 12-hour shift is so much harder because I need to have time to come home and stretch for at least an hour after. I stretch
Mm.
every single night. I used to call it yoga. Now it's not even yoga because I wish I did more yoga, but I sometimes can't escape for the mental break to
Right.
actually be doing
Right.
yoga where I'm mentally
Right.
there,
Right.
but I
Right.
can sit and stretch while I'm helping with math homework or something like
Right. Right.
that.
Right. Right.
And it's essential. I mean, I cannot, I just have to do that. And so there's things like
Right. Right.
that have come up now, and that's just part of what I have to do. So, yeah, so I forget again what
So
the
it's
question
affecting. No,
was.
no, no, no. It's good because we're
Yeah.
talking about coping with when you're
Yeah.
flaring and when you're
Okay.
in these kind of,
Oh yeah.
I would call them gray areas between fully well-controlled disease, like remission, medicated or unmedicated, and then full, horrible, debilitating flare-up. Like a lot of our
Mhm.
lives, we're living somewhere in between
And
those two. I mean,
yes.
ideally, you get to remission, stay there forever, and some people do, but a lot of people, this is a disease characterized by like flare-ups and remissions, kind of like, some types of like multiple sclerosis. So, but I think that's what makes it so hard. We're telling people all the time, or I'm telling people all the time, get used to uncertainty and you have to accept it. It's like, how do you plan your life? Like
exactly.
When like some days you can work as a 12-hour shift nurse and then go play water polo, and other days you can't. Like,
right. Yeah. And I think for me, like probably maybe it's stubbornness, maybe it's not wanting to let go of the functionality I had in the past. I don't know, but I feel like I sort of get to the point where I get almost to the point of like, I'm going to collapse. Like, and that like, I just sort of go, okay, I'm doing too much. So, and that was kind of what was happening like during the summer this year. It was sort of like, okay, I'm okay, but I'm balancing a lot. And I've added in school. So like there's new things going on. So can I really continue to do this to myself where I'm the 12-hour shifts in the ER? And if anyone's wondering, yes, I tried to go to days. That was not allowed. That's just a separate thing over here. But that's part of it. If you have a working environment that is not supportive or sympathetic or compassionate, which for various reasons, on some level they can't really accommodate, but it got to the point where like I started having to wear braces, like, or my gloves, things like that. Like I couldn't get through a shift with that. Oh, I can't wear gloves on my hands. I mean, I wear rubber gloves, but I can't wear my arthritis gloves at work. So if my hands are really bad that day, it's like, well, now I know I'm going into a shift with like just pain pulsing through my hands, it was like, maybe this isn't the right thing for me anymore. And that's okay. That was a hard thing for me to accept, but it also wasn't a rushed decision. I think it's really important for people to go, is this a gray area? Like, is this a flare up where I need to manage it for right now, but then it's going to get better? Or is this, are there other I had a lot of reasons to leave the ER. So for me, it was like, my health is a huge one, but there's all these other things too. And it's like, if you combine all those things, could my quality of life be a lot better if I gave up this job that I did identify as, it was part of my identity for so long, but can I get over that and kind of make it look different? You know what? Yeah, I can. And it's time to do that. It's time to put some other things first.
Yeah. I mean, I guess I would just imagine, and this maybe just be a misnomer, but that it would just be a very stressful career working in the ER. I mean, call me overly anxious, but I would find that a difficult environment to be in, like regardless of chronic illness.
Yeah.
But, I always think of that quote, like life is full of suffering, but it's also full of the overcoming of it. So I guess you might have some job of satisfaction in seeing like, oh, you're able to catch a heart attack early and the person survives and makes a full recovery.
Right.
But I mean, I don't know. How did you manage stress working in the ER?
I think for me, it was always the greatest honor. And honor was always the word that came to me. It was always the greatest honor to know that I could be that person who on someone's worst day of their life, not everybody's having the worst day of their life in the ER, of course, like we get a lot of stuff that's not emergencies, but when people are having true emergencies and they're terrified, I can come in there and go, okay, let me explain to you what's happening. Let me explain to you what we're going to do. This is how we're going to try to help you. If that doesn't work, let me know. Like I can take control of that situation and I know exactly what to do. I mean, for the most part, And so for me, it was always actually really empowering to be like, oh yeah, I'm the person who's going to help you feel better. Like there's just no greater honor. And even if it's, like when we did have people die and the family members are standing there, like there's nothing that feels like that when they're having the worst moment of their life but they will say to you like, thank you so much, or you're sitting there holding them while they're crying and they're like, thank you for doing this, or like, you do the littlest thing, like let me get you a cup of water, and they're like, okay. And they're like, you're so, and like they remember that. I mean, I've had people like send flowers to the ER and stuff because, I mean, I've
Yeah.
also had people, I've been there, I've delivered babies. Like, they're like, oh my God, thank you so much. Like it's that human interaction that
Yeah. Yeah.
is just so rewarding. So, I mean, I think, and it suited my personality. Like I was always I've been loud and kind of
Mhm.
boisterous, and I want to move fast, and I like the action and all of that, so like, I remember when I went to the ER, it was my first job out of nursing school. And I was like, these are my people. Like, this is where I belong. All the gross stuff that everyone that thinks is so disgusting. I love all that stuff.
See, this is where we're different.
So,
Yeah. I almost fainted the first
right?
time. I have fainted actually.
Really?
I fainted visiting a friend. I used to work in HR at a hospital before I became an occupational therapist. And she had she's sadly passed away, but she was a swing dancing friend who had a lot of heart issues, and she'd had a heart transplant. And I was like, oh, I work at the hospital. I'll come visit her. And so I'm like, la-di-da, like not thinking I was going to be, because I'm like, this is fine. Like, she's in the cardiac ICU, but like, she's awake and alert. And, I didn't know those terms and everything, but, they go in there and I just see all these wires connected to her and the scar. And I don't know what I was thinking I was going to see. And obviously, and I held it together while I was there with her, but then I took one step out in the hallway and just collapsed.
Yeah.
And my vision, I had never fainted before, but anyway, so then they took me to the ER of the hospital, just walk me down over there.
Oh man.
Like, I always said I've only been to the ER once, but technically twice, I guess. Oh no, they had an urgent care like attached to the ER. So they did they looked at my blood sugars and stuff. They're like, you just fainted, you're fine. But anyway, sorry. But yeah, so I love that there are people like that. My sister works in the neonatal ICU and she's like seen a lot of stuff.
That's a special.
Every time she sees like a full-term baby, she's like, it's huge.
Yeah,
the baby is a giant. And you're like, my child is 7 pounds. She's like, it's so big. But anyway, but I'm glad there are people, because I need that when I'm in a state of, I need someone that has a calm head and a warm and competent, presence. But I'm just, have struggled with stress management in working as an occupational therapist. And I'm like, we don't actually do any of the life or death, we're about quality of life. Right. But I apparently to my brain, sometimes quality of life is a life or death issue.
Well, but I always tell people this too. I'm like, people are like, oh, I don't, but the thing is, things get real clear when it's life or death. Like it gets real easy to prioritize when it's life or death. You know what? So that's
I know what you're
thing.
Saying. Yeah.
Like, because when the ER is like, when it's crazy and we've got a line out the door and, people have got abdominal pain and someone, sprained their ankle and, there's all these things, you're like that is kind of stressful because you're like, oh my God, we're trying to go as fast as we can. We're trying to do all these things. But then someone rolls through the door having chest pain, turns out they're having a heart attack. Guess what? Everything else stops. We don't deal with any, it depends on how many people you have in the ER, right? Like how many resources you have, not everything stops. But if you're the person taking care, and like I would often be the charge nurse. So like if I'm in charge of the whole ER, I all of a sudden am not worried about any of those people. I'm worried about this one right here. Because they're the one that's gonna go. So, and in that case, we know exactly what to do. There's very specific steps that we do down to the T, and everybody knows what to do. So everybody's automatically like, okay, we're pouring resources into this person. We're going to save their life. You can wait with your sprained ankle. I'm sure you don't want to, but you're going to have to. And you just move on. So sometimes like that forced clarity is actually really nice because it's like, nope, this is more important. It's just that easy. It's not me making a judgment call. It's this person is going to die if I don't. Yeah, it's just what it is. So it does make it easier sometimes when you're in it.
No, it's so true. We once, Charlie, we took him in for like a issue where he didn't need to see his regular pediatrician. It was like an ear infection or something where like, just take the first available pediatrician. And the one that was there, told us he used to be in the ER and now he works as a regular pediatrician or, just general practice, primary care. And he said, oh, this is way harder than being in the ER. And he didn't say it that way, but he said it like, I said something like, oh, wow, ER, that's, this is because he's like there's so many cases like where kids come in and it's like 90% of the time, it's not a big deal. But what about if it's that 10%? Like I had one of my very closest friends, her child had really bad RSV at 6 weeks postpartum.
Ooh.
And she took him in like 3 p.m. They're like, let's monitor, come back tomorrow if it's worse. And then by like 8 p.m. they went to the urgent care and they're like, you are going straight to Seattle Children's. The baby was intubated, like tons, like it was near death, and it happened so fast.
Respiratory issues with kids are scary because they tank really quickly.
Yeah, so scary. Anyway, so I'm like,
but that's exactly it. You're like, because you have to like make a judgment call. Someone comes in with a heart attack, you don't have to make a judgment call. Like
you're like, this is a heart attack. Yeah. That's interesting. But I think that's such an interesting juxtaposition though, for you, of being like rheumatoid arthritis is like the definition of a chronic condition that is not immediately life-threatening, but it is, it does slowly take years off your life if not controlled. It's about average before the current era of medications, the average life expectancy for someone with rheumatoid arthritis is 7 years less than average person. So sorry, not to bum anyone out, but that's why like your mom was like aware, aware of, and that's what they had to explain to my parents too. Cause they're like, oh, arthritis. Okay. Like it's not lupus. It's not cancer. It's not, these things that multiple sclerosis people seem to understand. Like it's a big deal, but there's all these little things every day where you're having to, over time, that they add up and always in gray areas. And I think that there's this kind of, I don't know if you relate to this at all, but this kind of, I think you touched on it earlier, this kind of question in the back of your head constantly, like is this as good as it gets for me now, this long into the disease, like, oh my God. Right? Like, how do you know what's like, I had to actually bring that up to my doctor the other day, or I brought it up to her because I was like, I don't like, this whole idea of treat to target. You're supposed to identify the target, the doctor and the patient identify the target, which is in the beginning, it's really obvious that you're trying to target full disease control, with persons diagnosed the first couple of years, get the fire under control, get them into remission, however you can. But I'm like, how does that work when I've had it for 20 years now? Like, do we still target that? Like, what do we target? And she's like, and it's kind of reminds me of that Marcel the Shell. And it's like, and it's like, people say, like, remember the Marcel the Shell? It's like a shell with shoes on. And she's like, people think I'm weird, but I say, compared to what? Like, she's a little shell with shoes on. Like, she can't compare it. Like, anyways, like she said, that's a really good question. And like, yes, like we are as you can probably tell from our past decisions, like we are no longer targeting or we're no longer thinking like it's realistic for you necessarily to go into like full remission again, or like that's not what we can hope for that, but let's plan for well-controlled disease to where, like I told her, what I want is I want to be not distractingly aware of my condition. I might be, do you know what I mean?
That is so, I've never heard anyone say it like that. And that's exactly what it is.
Yeah. Like
that's exactly what it is.
One is like, from being an athlete, it's like, I don't mind having that like muscle burn after I maybe overdid it. But what I don't want is it to be so bad that it's constantly distracting me from living my life. Like I can, it's amount of pain that I can, quote unquote, tolerate. But yeah, so that resonates with you too.
Completely. Yeah. And in fact, like I was talking to someone the other day because I was talking about how cannabis has helped. And one of the things that I was saying was like, if nothing else, it can get me to a point where for a period of time, I don't feel pain anywhere. Because pretty much at this, and this isn't all the time, but right now, this is what I was saying to you, before. Right now, I'm in kind of a hard season where I am in a mild amount of pain. It's not, on the number scale, I'd probably call it a 3 or a 4. And so it's noticeable. That's why when you were
that's a lot for every day.
It's noticeable. Yeah. Right, for every day, all the time, where I only get a break for a little bit at night before when I'm medicating and I'm done with my responsibilities for the day, got my kids to bed, I'm able to do my hour of stretching and medicate. That's when my body feels better. And then I can fall asleep. because I feel better for a little
Right.
bit. And then hopefully I stay asleep and then wake up. And when you wake up, I'm sure you can appreciate this. You wake up and you're like, here's another day. Oh,
Creaky joints. Yeah.
right. I lay in bed every morning and just start moving with this first. I lay
Mhm.
there for, I don't know, however long it takes, but that's, so yeah, I
Yeah.
think, and that's where it's like, sometimes I ask the question, am I ever going to is pain free a realistic thing for me to hope
Mhm.
for? I'm not really sure if it is or not. I, if it's not, that feels like so much. And I know we're going over time. Sorry.
Oh, no,
So
no, we
I'm,
are. We are fine. We're fine.
we're okay. But it's also one of those things where for right now, try not to think too much about it
Mhm.
because I can't do anything about this. I'm doing what I can do by
Right.
managing
Yeah.
it on a daily
And
basis. And that feels like a heavier lift for me that I do have to manage it this regularly every day. But
mhm.
that's where we are. And ultimately I have to be able to function for my kids, for my life, for everything. So if that's what is required for today, then that's what is required for today. And I'm going to do my best to meet those demands. So I try to
Yeah.
just do it one day at a time. But
No,
what did you said? Distractingly
I want to not
aware?
be distractingly aware of
Distractingly
my
aware.
RA. Like I can be
That is
aware of it.
exactly
Like I
what it
have,
is.
mild pain symptoms. I have such a hard time rating it on a scale of 1 to 10.
I
I like to
know.
break it down
Yeah.
into the subcategories. Like it's like a 5 on stiffness, but like 0 on sharp stabbing pain, but like maybe a
Right.
3 on like soreness or hot
hmm
tenderness,
hmm
but yeah, I think that's where
And there is
mindfulness.
different qualities. Yeah.
Yes.
The quality of pain is different. And so it
And
makes a
some of it
difference.
is interferes with your quality of life more than
hmm
others. But I think for me, yeah, the mindfulness standpoint of like what's going on in the present, because the future is so unknowable. There were only 3
hmm
medications in the category of biologics when I was diagnosed. Now there's
Mm.
9, so maybe maybe both of us will be talking in 3 years. So now be like, oh, I'm so glad that the new
It,
medication Zorbjandol or whatever they call it, you know,
right.
uh,
Right.
yeah, came out and now we're in remission again. And that's awesome. It's like
Right.
or we
Yeah.
could be horrible. And it's just, you just don't know. So you just have to say, this is what I know is the present.
Exactly.
Okay. So do you have 15 more minutes?
Oh yeah, I have
Okay.
plenty of time. I just
Okay.
felt bad because
Oh,
I was like,
good. No,
we
because I
could
did.
talk forever.
I know. We're chatty Cathy's. No, it's so good. It's
Yeah.
so good. And I wanted to just touch a little bit, and not to like toot my own horn, but I did want to know what you thought of the Room to Thrive group, which again, it can be challenging with the schedule you were working to make, the meetings that we try to
Yes.
make them at times that work for people. But what were some of the things that helped you? Despite all the stuff, all the knowledge base that you obviously had going into it.
Well, but you know what? So number one was the community because I
Yeah.
never had community before.
Yeah. Yeah.
Um, and so just hearing other people talk and having that validation of it's not in my head. Like they're feeling the same things that I feel. They have trouble with the same activities that I have trouble with. Like
Mhm.
because I always, and I don't know if a lot of people do this but I always default to, I'm making this worse than it is. I'm building it up in
Totally.
my head. I'm right.
I'm doing it
Because
wrong.
I'm right. Exactly. And so hearing other people be like, oh no, like, there were a lot of times where I was like, oh my gosh, okay, it's not just me. Like other people get this too. And so there's a lot of third party validation that was awesome. Um,
Yeah,
and
yeah.
everyone was so helpful offering up different, whether it's like tips or tricks or products or resources to read or listen to, like all of that kind of stuff, and you can kind of pick and choose, which is really nice. I never really had any of that, and I never even my rheumatologists weren't offering up things like really like that. So
Unfortunately, I
um
really want it to be the standard of care at some point,
right,
like if you went through like, because when people get diagnosed with diabetes, they have certified diabetes educators and they walk them
educators,
through
exactly.
And it's not necessarily a group setting, but at least it's someone guiding you through the day-to-day realities. And then with like an optional, oh, you can add, if you want the group support in the community, like that would be ideal. I just like, I'm like too impatient. Like I can't wait for the health system to change. I'm going to make this myself.
No, exactly. But that's what's like, and I think, some of it for me also, particularly with you, is like your story resonates with me in so many ways that it was like, oh my gosh, you really get this. Like, and so that, like having the leader be you and
thank you.
being so well, but like truly like you're great at accommodating everyone. You're great at
thank you.
Laying everything out, explaining everything being accessible. There were several times, I think I told you this, I don't know. I think I did, but like I missed a couple and I could go onto the website and like go through the PowerPoint and watch the recording. So it felt, and it would be funny because I'd be like talking to the recording as if like, oh, I want, commiserate or whatever,
Yeah, like
but
me too. Like, sorry.
Yeah, but like, that's okay. Hi, Teddy. Just being able to feel like if I was having a rough day or a rough time, and I could go to that resource and be like,
right,
it's just right now, I'm just having a hard moment and that's okay. And look at all these people who have these moments too, and they get it. So I can share that with them, even though they don't know I'm sharing it with them because it's a recording, but I'm sharing it with them. It really helped a lot. So, I mean, there were so many things that were so helpful with it. And I think also really empowered me to be like, also I want to, ask my doctor about this thing, or it seems like I could be handling this part better. So I've got some ideas here, but I'm seeing what other people are doing, and that's making me be like, oh, I need to prioritize this part because I've been putting up with it for so long instead of actually trying to fix it. Let me see if I can do something about that, So yeah,
that's
I mean, there were
awesome.
tons of aspects of that I love about Room to Thrive.
Yeah. Oh, I'm so glad. No, and it really is, it is like you said, it feels like an honor, when you work in the ER, it definitely feels like an honor for me to be in the position I am with running the groups and, I mean, it's that cliche thing teachers always say that I'm supposed to be the teacher, but I learned more than anyone else learned or whatever. Like, but I do always learn a lot. And it's like, it is therapeutic for me to hear. It's the same thing you said, that I do tend to be really hard on myself. And even I'll have these like meta thoughts, like you're the one leading the group. You should have it all figured out. And I actually talked to my therapist about that with respect to a different job I had as an occupational therapist. And I was like, I hate saying, I don't know. If a parent asks me a question, or if I just don't, I hate the feeling of not knowing, or because there's so many gray areas. Like I was working in developmental disabilities, like autism and stuff like that. Wow. A lot of gray areas. And, he was like, well, okay, like you need to then your home, like, or well, okay, I had two different therapists, a male and a female. So it's, I'm like I'm always like, okay, the male one said this and then the female one said this. No, but I had the female one first and then I had the male one, but I talked to her, she brought it up too. And she was like, if you wait to do things like your life goals, like I want to write a book and I want to do all these programs, all these things. She's like, if you wait until you know everything, you're never going to do it, and I'm like, oh, that's so true. Like, I've kept that in my head. And this in the male therapist is like, what if you just practice saying, I don't know? Like, do you need question your question? Like question the assumption that I have is that I have to know everything before I can help people. Is that actually true? Like, do I have to know all the answers about rheumatoid arthritis when actually nobody knows all the answers anyway?
I was just gonna say, nobody has all the
answers. Actually don't flatter yourself to think that like you could even figure out all the answers. Like,
right.
Like, because I literally anyway, so yeah.
Well, I was gonna say, like, it's interesting you say that because I feel like, I mean, you definitely do feel like an authority on it. Like I do, like you're well read and you definitely research things, and I definitely appreciate that. But you're also very relatable and you're also very open, and you put all of your own experiences out there, which I think resonates. Like I don't want to listen to somebody who doesn't have RA tell me about RA. I mean, maybe if they're a doctor,
it's better than nothing,
fine, and they've studied it. Yeah, fine. But there's a lot of value in hearing from someone who's not only educated, but also totally understands the symptom. I mean, it's nice that you understand specifically RA, but with any autoimmune, there's a lot
Yeah.
of with a lot of autoimmunes, there's a lot of overlapping symptoms. And so like you understand the complexity of that and the emotional side of it. Like that's a part that none of my rheumatologists that I've ever had have really understood is or even talked about is like the mental health side, the
Yeah.
the anxiety, the depression. And I was never diagnosed with anything beforehand. As an adult, I do feel like I probably should have been because of various things, which is a whole other story. But but I'm a functioning adult, so that's fine. But like that definitely plays into RA, and I
Yeah.
don't think that that's
Yes.
something that they don't really know how to talk about it. I don't,
And they're not trained to, but if you do, I think there has been a sea change in a lot of like chronic conditions. I guess I would hope there would be. I might be just like selectively filtering what I see, but understanding that there are many triggers of inflammation, dietary triggers, sleep, exercise, lack of exercise and movement, and mental health, stress triggers inflammation. And that's part of you have an inflammatory disease process, but it's just, they just don't have adequate time to, talk about everything that they might want to talk about.
Well,
but yeah.
And I should just say here, they have all mentioned to me, well, the ones that I've had since I started working night shift, they've all said to me, like 12-hour night shifts in the ER, like what? Can you not do that, please? And I was always like, no, that's not the issue.
I'm the
like,
exception. Yeah.
Right.
Yeah.
So they did try on some levels with some things, and I was like, no.
Oh my gosh. Again, there's a real stubborn streak in rheumatoid arthritis, for better, for worse. But okay, so it's time for rapid fire questions, which is, they don't need to literally be like one word, but I have some fun questions. First is like, what's like your best piece of advice or word of wisdom or encouragement for a newly diagnosed patient? That's a lot. That could be a whole episode. That is a whole episode, but yeah.
I know exactly. Gosh, I mean, I think what I would say, we already talked about it, but it's really just, it's a journey. And if you come from a place of wanting to just take care of yourself the way that you would want to take care of a loved one, then you will steer yourself okay. But it's not a straight line. It's not something that you're just going to take care of and be done. It's just, it's a roller coaster. And so just know that going in, that like, there's a lot of things that are in your power to help take care of yourself, and know that, but also know that there's a lot of unknowns. So just keeping yourself, and what your needs are and whatever those may be, and they might change, but like, just keep that at the forefront, and you'll just have to keep course correcting as you go.
I know. I really wish I had thought of that when I got diagnosed, or known that, or internalized it. Again, my sister's actually really, she always mentions like it was really instructive for her to be like, she was at my bedside, like during our C-section for Charlie. And then she was there, the whole time. And she, after, for 2 nights at the hospital and everything. And she says that there were so many times I told her, no one told me this, or no one told me that. And she was like literally physically there and heard them tell me, but she was like, the things we tell patients is not necessarily what they remember or hear. And so I thought, so sometimes I'll say, no doctor ever told me this. But I'll kind of try to amend that a lot of times, be like, I don't remember anyone telling me this, because it's very possible, they said this, like, I'm like, blah, blah, blah. They're saying all these things in my head. The messages I'm filtering through are in my initial diagnosis appointment. I was right. I'm not crazy. I'm not a hypochondriac. I have a diagnosis. There's some shit you can do about it. Woohoo! Like, what's the problem? Why are you looking so serious? Like, this is a net win for me, because it means I'm not suffering and literally wasting away for no reason. There was nothing stressing me out. Sorry, I feel really defensive about this, and I've processed it many times, and it's apparently going to be a perpetual problem. I'm like, it's so rare to have someone with no traumatic childhood, no traumatic events. Both my psychiatrist and psychologist have confirmed my family and my upbringing were a positive outlier, like literally a positive outlier, like wonderful family, wonderful everything, literally. I mean, I'm like, they could be like, you're just stressed. Nothing was stressing me out. You people telling me I'm not sick when I'm clearly sick is what's stressing me out.
Exactly.
Like getting sick out of nowhere is a stressful experience, especially when every time you try to get help, they tell you
you're not.
You're like, okay, now I'm officially stressed and about you people.
Right.
Sorry. Oh no. Back to you. Okay.
No, I get it.
I'm sure. Yeah. There might be some of those moments and maybe even in the ER where someone's like, I told the doctor that this is weird, like stomach pain I've been having in my lower left abdominal quadrant. And they were like, no big deal. And they're like, it's appendicitis. Like, I was right.
Right.
Or is appendicitis in the right quadrant or the left? I always forget.
Well, so it's in the right quadrant. Your appendix is in the right lower quadrant, but you can have pain in the left quadrant and it can still be appendicitis.
I hate bodies.
You're not wrong. Yeah. You can also, a lot of people start like periumbilical, which is like around the belly button. Oh. If it starts there and then it migrates to the right, that happens a lot too. But we usually, like in the ER, we look for other, like, do they have a fever? Do they have an elevated white blood cell count? Like there's other things that we use. And then we CAT scan them and see their giant appendix all inflamed.
Side note, I have a friend who had acute appendicitis at 32 weeks pregnant and it wasn't in the right area. So they didn't catch it at first because everything moves around when you're pregnant. And then, but she had a successful appendectomy and the baby stayed in until full term.
Wow.
Isn't that,
that's awesome.
I know.
That's
They're
so
like,
cool.
put me in the textbook. Okay. What's the favorite arthritis gadget or tool in your toolbox?
So I actually was thinking about this. It's my gloves, which I got because of you.
That's come up every time. Yeah.
My gloves and my mouse, which I don't have because I'm not at my desk, but the mouse, ergonomic mouse. Yeah. I got one. Mine's blue, but it's the exact same one. Exactly. And ordered it because of you. And as someone who, then I started grad school and it makes a world of difference. I never would have thought something like, it seemed minor, but because I don't sit in front of a computer all day or anything like that. Like, to me, that's something, but it makes such a difference.
This is like super nerding out, but like if you do, I know you learn the anatomy and physiology in nursing school, but if you really get into like the kinesiology of the hand specifically, it was so many muscles, so many tendons, so many, it is those small changes, holding a mouse like this versus having that rest, having it more with your wrist like this versus that. There's these tiny differences that make, huge over time.
Such a difference. Yeah.
And do you have a favorite piece of like content you've either like a book or a movie or show that you've been into recently?
I just read a book.
Do you have any time? Like your 3 kids.
I did just finish a book that's called, I wish I had it up here. It's downstairs at my desk too. It's called Cassandra Speaks. And the author is Elizabeth Lesser, I think is her name. But the book is actually it talks about how a lot of the stories of the world have been told from a male perspective. And if they were told from a female's perspective, what a difference it would make. Yes. It's just interesting. It's an interesting book. It's really, it's good. It's good. And it kind of helps you think about perspective, which if you're dealing with an autoimmune and you're, like even in that, it helps with things. Cause I'm like, well, I'm projecting it that way, or I'm encapsulating my disease that way. What if I look at it from this perspective? Or, you know what I mean? Like, it doesn't have to be all or nothing. I don't have to be a varsity athlete anymore. I'm not a varsity athlete anymore. So that's not what we need to achieve. I don't need to be, but if I get up and move, is that good enough for me? Yeah, that's good enough for me. So like, it's a great story. Like it's a feminist story. I'm kind of a feminist here, so I like that. But it also was just about perspective and kind of thinking about things in different ways. So it's good.
I love that. And I think, I think if you were an athlete growing up, it's like you define yourself by these results, right? But 100%. Like I got this, and I still remember my best mile time, I'm like, I'm a badass, but
oh my gosh. Yeah.
But like,
I was gonna say my daughter's on the swim team and I just entered that work. So now I'm sitting there going, oh, when I was 11 and 12, I got these times.
Oh yeah. Like, my splits were 62 or whatever. What were yours? Yeah.
Right.
I know. It's so funny. That stays with you and it's good. I'm always going to be proud of that. But if you look objectively at the amount of effort it took, me to run a 5.5 minute mile is the same effort it would take me today to run, I don't know, an 8 to 9 minute mile,
Right.
not even, probably more like 9 to 10, because I'm really not in shape right now. But at the same time, it's the same effort. So what is it that you're going to define yourself by,
Yeah.
Yeah. It's kind of like that growth mindset thing they're saying about kids, you have to like praise the effort, not just the result. But I'm like, human beings are always going to be results oriented.
But also, exactly. But I'm like that mama. It's like, not everybody gets a medal. Okay. Somebody wins, somebody loses.
I told you.
It's harsh, but
I'm like, certain people, some things come easily, different people. Like you learn to read really easily. Like he's reading like so far beyond his grade level. It's crazy. But I'm like, but drawing is really hard for him. So of course, what he's taking for granted the things that are easy for him. And he's like, but I really want to draw as well as, this person in my class. And it's like, this is your best. Like you can't do her best.
Right.
Like she's doing her best. And you're doing, but I'm like, that's the same coaching my parents had to give me. And it took a long time to draw. So they'd be like, I still remember like Amy DeSaki, like her pointillism art was so perfect. It was so perfect. She got all her little dots and I wanted to be like her so badly. And so anyway, we have to deal with the issues. Do you have a favorite mantra or inspirational saying or something you repeat to yourself in tough times?
Well,
it's okay if you don't.
I know. The one that comes to mind, and pardon me, I mean, I almost don't want to. I think I've said this one on one of the Room to Thrive, one of our meetings. When the pain is, and this is like if the pain's really bad, like usually this is if I was coming home from a shift, to be honest with you, and sitting in the car trying to drive, and my just from the waist down, basically like my hips, my knees, my feet, everything is just hurting so much. But I would just repeat to myself, it's just pain over and over and over. And I'm not in the sense of like, it's just pain, like no pain, no gain. I don't mean that. I mean, like, it's just pain. It's something that my body is feeling. It doesn't have to be emotional. It's a feeling that I feel, but for me, like I would tie that into, because when we're dealing with chronic issues like this, you're like, well, what is this pain? Okay, am I headed into a flare? Am I going to not be able to walk? Am I going to be able to lift my daughter up? Am I going to be able to get up and down the stairs and lift the laundry? And it's not those things. It's just right now it hurts. That's all we're at. That's all it is. Right now it hurts. So as soon as I can get home and deal with it, and because usually it was in the car when I would do this, and I had like a 40-minute drive usually. So it was like, I just have to do this for 40 minutes and then I can do it at stretch and I know I'll feel better. But so for me, it's just pain. It's just pain. And I would repeat it and I would be crying sometimes, like, but it's just pain. It's not the end of my world. It's not the end of my life. It's just pain. It just hurts. And so I would just repeat, it's just pain until it wasn't there anymore and I could. But I don't know, for me, that helped me, like I said, take the emotion out of it and be like, it's just a physical feeling. It's fleeting. It's going to go away. I'm not going to feel, do I feel this every day? Kind of, but like, it goes away. That intensity. Not that intensity. Right. And so that was one thing. The other thing, and this is sort of a weird one to say, but my sister told me this story and I can't even retell the story because there's details that I don't remember to it. But basically, there's the story of a friend of my sister's met this woman and she was on like a yoga retreat somewhere and it was in like somewhere beautiful, right? So I don't remember exactly where, but like somewhere, some beautiful like tropical place. And so there was this woman who they were staying like in this house. People knew who she was. She had like a ton of children. She did all this work in the village, blah, blah, blah. And so my sister's friend said to her, how do you get all of this done? Like, how do you do it? And there's more to the story, but basically she said, ek, ek, ek. So EK, which that's all she said, ek, 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 which basically just means one.
Yeah.
And so the nice thing is like my sister is the one who told me this story, but sometimes I can say to her, like having a bad RA day, she'll just reply to me, ek, ek, ek.
Yeah.
And it's
Like
like,
1 minute at a
just
time.
one,
Yeah.
just do one, right? Like one, just do what's the one thing you're doing right now, whatever it is,
Yeah.
and and it's that reminder of like, and I've been thinking of that a lot lately because there's a lot of like, for me, it's like, what am I doing now career wise? If I'm not in the ER, what am
Mhm.
I doing? There's all this, and it's like, just right now, just this, right, stay in this moment. This is what I'm doing,
Mhm.
or
I love
so
that.
those
It
are the two
reminds
things I say the most probably.
that reminds me a lot of that opening to the Unbreakable Kimmy Schmidt, where she's like, you can do anything for 10 seconds. Like, I don't know if you just watched that
Right.
show, but it's like,
I haven't, but
yeah. And but the just pain thing is really interesting. And there's that's something I say to myself about anxiety too. Like, because I still am prone to like
Ooh.
claustrophobia induced like panic attacks and episodes where I
Mhm.
really hate feeling like I can't escape something, whether it's like an
Mm.
airplane or an elevator and car wash, like literally anything, being in a tunnel in traffic,
Mhm.
and so I'd be like, it's just like what's happening is anxiety. Like it's a story my brain is telling myself, it's flooding me
Yeah.
with chemicals and I'm feeling dizzy and I'm feeling like I'm about to go, burst out of my head or something,
Mhm.
but it's just anxiety. It's so I don't know why, but
Mhm.
that does. Sometimes it helps, other times it doesn't. Yeah, you kind of have to have lots of
Yeah.
tools in the toolbox.
Yeah. No,
And then
it's
oh yeah.
funny. I was just gonna say with anxiety, like I've never actually applied it, and I should because my daughter has anxiety, and
Mm,
I've said to her before, this is your mind telling you a story that's not true.
yes. Yeah.
Like your mind is telling you, like she is swimming now, and so she's afraid to dive off the block for races and stuff. And I'm
Oh,
like, first of all, you don't have to. We'll get to that point. But second of all, like your mind is telling you it's really high up, it's really scary. What happens if you enter the water
mm-hmm.
wrong, or whatever? And it's like, but physically, can you do it? Yeah, you can. You definitely
Yeah.
can. It's your mind
Yeah.
telling. So I should use that for myself too. Is what
Is
I'm.
it? No, it's true.
That's
It's
so
yeah,
smart.
interesting. Or thank you, brain. I'll try to, if I'm in the early stages of ramping up, I'll be like,
Mm.
thank you, brain, for trying to protect me. I know you're trying to tell me
That's
that this
smart.
is
Yeah.
because it is. I really think I always like tell my husband, I'm like, it's like I would have been the person like going into the cave and the caveman days, been like, guys, we got to think of a way out. Like, we don't want to get trapped in here. Like, there's an
Right.
evolutionary advantage to like thinking of the worst case scenario
Yes.
constantly.
Yes. Hmm.
And
Absolutely.
anyway, so I'm like, thank you, brain. Like, you're a really good, thinker over there, thinking of all the worst case scenarios. Um,
Yeah.
and then, okay, last two questions. What is
Mm.
bringing you joy right now?
What is bringing me joy right now?
What sparks joy?
Well, um, my schoolwork and that community of because COVID was really hard. Working in the ER was really hard during the pandemic,
I'm
and
shocked
that.
to hear that. Just kidding. Yeah. Oh, and that was what I was going
uh,
to ask. I kept thinking, what was I going to ask? Yeah.
oh,
Okay. Sorry. Yeah. Well,
that's
you're
okay.
probably sick
But
of talking
yeah,
about it. Yeah.
so no, not but just having that community where um it meets so many needs for me. Like it's intellectually stimulating, it's
Mm-hmm.
something I'm
Mm-hmm.
passionate and interested about. It's it's fun being an adult learner when you're learning things you really want to learn and pursue. And then to feel like that education has helped so much with my own medicine and my own care of the disease. Like I've felt really empowered with that. So
Yeah.
um honestly, it's probably, yeah, that being in
What
school.
is it? And Matt, you said it's a master's in what?
It's so the title, it's a master's in medicinal cannabis science and therapeutics,
Wow. Okay.
which is, yeah. So it's through the School of Pharmacy at the University of Maryland.
Oh, okay. Wow. Okay. It's through School of Pharmacy. I'm just
Hmm.
writing this down because I think people would be
Yeah.
really interested in that.
Yeah.
And then last one, just a small question.
Hmm.
What does it mean for
Hmm.
you to live a good life with rheumatoid arthritis? Hey, and also what's the meaning of
Oh,
life as long as we have time?
yeah, yeah, right. um, I think I kind of go back to like what I was saying for someone newly diagnosed. Like it's really just about just being like honoring myself
Mm,
and because I think I've always been that person that was like, I'll just bear the brunt of whatever, and
all
I can take it.
sacrifice.
I can take it
Yeah.
on. Yeah,
Yeah.
like I've with my siblings and with like I've kind of always been that person because it never felt like it was that hard for me. It was like, well, it's easy. I can just do it. I'll just, not like I'll take on the task, but like I'll like, I remember we would like, if we'd be going through trying to pick out food or something like that, it'd be like, well, I'll just take whatever's left. Like you guys get what you're all, and it's like, for me with RA, I can't be the last one every single time. Maybe sometimes I am, but sometimes my kids have to wait. Sometimes it's a no, because tonight mommy needs to take care of myself. So for me, I think it's just keeping, not necessarily that I'm always first, but like, well, maybe that I am always first. And that's like, sometimes I know I'm like, okay, I need to do this, but I can help the kids with whatever. Like, but just knowing like I'm keeping my needs at the top, because if I don't manage those needs, everything will fall apart.
Oh,
and just, and knowing that that's not being dramatic, that's being honest and real about this disease that I have to manage every day, and not being mad about it or bitter, or just being like, it's okay. This is what it is. And this is what I need to care for myself. Like that, I think is, for me, like that's a huge achievement, to not either feel self-pity or guilty or shame.
Yeah. No, it's
Those
so true.
Here.
I absolutely relate to that so much. My disease has taught me to have better boundaries. It's taught me that it's okay for me to say no to things. I don't have to say yes to everything. And but it can be hard when you define yourself as being that person that's always reliable, the person that always does everything, the person that's there for everyone.
Oh, yeah.
But you are only human, and having boundaries is a good thing, even if you didn't have this disease. You know what I mean?
I was just going to say, and it doesn't have to be just because I have RA, but apparently I needed to have a chronic illness.
No, we're the same. We are soul sisters here.
Yeah.
And we're in what they call the Oregon Trail generation, the generation.
That's right.
It's a really unique generation between Gen X and millennials. Like it is kind of interesting, but okay. Well, thank you so much. I know we've gone over, but we talked earlier that it would be okay to go over, but I'm grateful. And if people want to connect to you online, I'm going to put your links in the show notes, but what's your Instagram handle?
It's EPK Jacobs.
All right. Perfect.
That's generally where you can find me for everything.
Yeah. Is there anything else you wanted to say before we wrap up?
No, just thank you so much. Okay. I know. And you're wonderful. And I'm so thankful for everything that you're doing, because this community needs you. So thank you.
Thank you. No, and speaking about, thinking of not overtaxing yourself or having boundaries, I am trying to one of my goals for 20. Well, first of all, thank you. I don't want to gloss over that. I appreciate that, because the worst thing, right, would be to have be like, I have this great idea, I'm going to make this program, and have people be like, we don't like this, or this wasn't helpful. So I don't take it for granted that people are finding it helpful. That's awesome. But I'm also trying to think about ways to kind of make it sustainable. That I don't have to necessarily grow beyond, what I have right now in terms of groups and stuff, but I'm thinking, I did get COVID back in August, and luckily it was a week I was planning on taking vacation anyway, but I'm trying to think again, plan A, plan B, plan C, and how can I make this maybe bring in some more facilitators and make it so that it's not just dependent on me. That way it's again, something that maybe other people can replicate and get spread to more, have it something, because it's right now it's you just randomly, people find me through either the podcast or through I looked up the hashtag rheumatoid arthritis on Instagram, and I think I want to figure out how to make it available or known to people who might want this are out there, who might want Room to Thrive, or more support than they're getting. So anyway, so sorry. That's about me. But no,
that's okay. Yeah, that's awesome. I'm so glad to hear that, because it's helpful for anyone, whether you're at the very beginning or you've been dealing with it like we have for nearly 20 years. Anybody will get value from it. So that's another huge thing.
That's actually one of the most frequent asked questions I get. And I actually have said what's weird, because I was concerned about that at first, but first of all, there's benefits in having groups, multi-generational groups, in terms of age and in terms of length of diagnosis. Because, we have some the 22-year-olds that are my boyfriend's being mean to me because of my arthritis. And then they have they'll, people in their middle age, oh, he's not worth it. Like you have that, but you
Right.
also have the like people who've had it, like the feedback I get from people who've had it longer is actually sometimes more positive than the feedback from people who have it shorter, in the sense that they have experienced the pain and isolation of trying to figure it out on your own. So the people who like
Yes.
just got diagnosed, so like, this is great, but like, I didn't have to have that pain before of not having this kind of support. So anyway, so that's why
Yeah.
I tell people, but I'm also like, yeah, I mean, like someone asked me, like, am I going to learn anything in your program that I don't already know? And I was like, well, I can't answer that without knowing everything that you know. Like,
Right.
but I'm like, it is a twofold. It's information. And I said that definitely the mental health and the social, the social and relationship parts are things that a lot of people never get any instruction in. The basic
Yeah.
pain management techniques they often do know if you've had it for a while, but I said the community is not something that a lot of people have had either.
Yeah.
So
Yeah.
anyway, but I should wrap up. It's early release day for Charlie. So
Gotcha.
our
Okay.
parent teacher conferences. But thank you so
Oh, fun.
much. I really, really
Yes.
appreciate
Oh,
it.
thank you. Yes. Anytime, Cheryl.
Okay. Bye for now. Thank you so much for listening. This podcast is supported by Room to Thrive, an educational program I created to help empower you to live life to the fullest with rheumatic disease. In the program, you're going to learn evidence-based tools for managing all the ways rheumatic disease affects your life. And my goal is to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded modules on your own in the self-paced course, or you can take the course along with a robust support group of new arthritis friends to support you and cheerlead you along the way. Learn more in the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I'd be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also want to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on the Arthritis Life website, plus full episode videos on the Arthritis Life YouTube channel. If you have any ideas for content for future episodes, or you want to share your story on the podcast, please send me, Cheryl, an email at info@myarthritislife.net. I can't wait to hear from you, and thanks so much again for your time.